Did you know that your femur doesn't always attach to your pelvis the same way? In fact, anatomical variations like Coxa Vara, Coxa valga, and acetabular dysplasia can dramatically influence your movement, joint health, and even surgical outcomes. Today, we're uncovering these hidden deviations and what they mean for patient care and orthopedic surgery. Welcome to Ortho Implants for Life, your one-stop channel for everything related to orthopedics. Today, we're diving deep into the fascinating world of femoral pelvic attachments. Whether you're a surgeon, medical student, or patient, this video will illuminate why no two hips are exactly alike and why that matters. Before we start, let me be very clear that this video is for educational purposes only. Consult a qualified orthopedic surgeon for personalized medical advice. Let's start with the basics. The femur is the longest and strongest bone in the body, forming a ball and socket joint with the pelvis. This joint enables us to walk, run, squat, and climb, bearing forces up to 8 times body weight. But this isn't a simple hinge. It's a complex structure shaped by 3-dimensional anatomy. Factors like neck shaft angle, anteversion, and femoral offset impact joint mechanics and motion ranges. Here's where it gets captivating. Each hip can vary significantly anatomically. Coxa Vara, neck shaft angle below 120 degrees to 135 degrees. This causes a shorter limb and limp. It can be congenital or develop later due to fractures or bone disorders. Coxa valga, neck shaft angle above 135 degrees, often seen in conditions like cerebral palsy. It can increase hip instability. Acetabular dysplasia, characterized by a shallow hip socket, present in up to 4% of adults. This leads to instability and predisposes patients to early arthritis. There are also variations in femoral anteversion, the forward twist of the femur. Adults normally range between 10 degrees to 20 degrees, but even plus 1 degree can increase internal rotation by approximately 0.25 degrees. These anatomical differences aren't just trivia, they're game changers for surgeons. In hip replacement, incorrect neck shaft angle or offset can alter muscle mechanics, causing pain, limp, or hip dislocation. Acetabular dysplasia with abnormal socket coverage requires precise cup positioning to avoid edge loading and implant wear. Pelvis and femur orientation vary between standing, sitting, and walking, so static X-rays won't tell the whole story. So how do surgeons manage this variation? It begins with advanced imaging, CT scans, 3D modeling, and gait analysis that map each patient's unique anatomy. Emerging systems like CPAC classification and AI-based modeling help tailor surgical plans, ensuring implants match one's constitutional hip geometry. Understanding femur-pelvis variation isn't just academic. It's essential for improving implant longevity, function, and patient satisfaction. As anatomical personalization becomes the standard, orthopedic care will become more precise and adaptive.
If you have enjoyed the video, like it, share it, and if you are new to our channel, subscribe it. Hit the bell icon to get notifications for all our upcoming videos. Join us to excel in this orthopedic implant industry and to know more about the job and career growth which is available in this industry. Thank you. See you again next week.